So here we are back at Dr. Christiana Marron's place. I got this is day 3 of physical therapy. I've done a couple on my own at the house. You can check my Instagram for that. But I'm gonna go ahead, check in with her, see what she wants me to do, and then tomorrow I'm getting my stitches taken out. So it's been about a week since the initial procedure. Feeling a little stiff, a little sore, but good progress so far. So let's do it. I'll need this shit. That's
really nice of you.
I don't need none of this. All facade. I'm actually not even hurt. Did it for y'all.
How's it been feeling with the exercise?
This feels good to get this shit off. Man, there's so much pressure on it.
I know. But once you get the stitches out too, it won't feel like it's pulling as much anymore too.
So much swelling.
I know.
Shit.
How's showering and stuff?
I can't shower. I'm fucking dirty.
And it looks pretty good with the extension, which is, like I said, that's the most important thing, is that you have that extension. Okay, so we're gonna measure it up with the greater trochanter on the side here. And then our other point's this lateral malleoli down there. Okay, now squeeze that quad down for me. So we're gonna do it on a Russian stim, which is more neuromuscular stimulation, not just for pain relief. We'll do that at the end when we ice on. But we gotta do it around the dressings right now until he gets the stitches out tomorrow. So next week we'll be able to start doing that.
Ooh.
So I'm gonna work on the left side because obviously he's got a weight bear more with that leg, and it has taken the brunt since what, December? And next week when we see him, we'll get to start doing a lot of scar tissue mobilizations. I'm gonna get him to do some ankle mobilizations, work his foot more.
And I'm multitasking. I gotta contract the quad, pull the heel.
So you gotta use your brain today?
Chew gum and walk at the same time.
So we're just doing some lymphatic drainage because I'm not going by the incision and I'm keeping the dressing on. And I'm just pumping everything up towards the heart. So starting at the hip and then coming this way. So all my pressure's coming from here up, just like the dressing. And that should feel good to him because he hasn't had it touched since surgery. Like I said, once he gets that dressing off and the stitches come off, we're gonna start moving it, doing some scar moves. Patellar mobs, I'm gonna do some patellar mobs in a second. Patellar mobs are like when you mobilize any other joint, you're actually moving the kneecap side to side, top to bottom, and then angles. So a lot of people don't realize that the kneecap does move on a tilt. When I get someone who's like only 3 months post-op and like they have a quad tendon tear and they never got hands-on work at all during those 3 months, it's more work for me because that scar just holds so much problems. So the main focus of the first week is obviously keeping you safe, right? Making sure that you can get some sort of extension into the knee, because that's gonna be the most important. If he doesn't get extension in those first few weeks, that's when a lot of ACL surgeries go bad. Where the walking's affected, gait's affected, running's affected, jumping, balance. So the extension's the most important part. And then getting ankle mobility, ankle strength back to the foot. He couldn't feel his foot though for the first 6 days, so it's important that he gets that back as well. Working the whole body is gonna be very important for any patient, ACL, knee, because if you don't work the rest of the body, then it'll go to crumble as well. So core, upper body, you saw Phil training upper body. Do some passive range of motion now. So passive range of motion is when someone else is actually doing the range of motion for that person. Active assisted is something we'll show in a little bit with the heel slide that Phil's done. So that's the use of something else, maybe another body part or a band or a rope to actually do the motion. And then he'll eventually go into active range of motion stuff. So I'm gonna just try and passively flex it and then extend it. Give him a little traction there too. Traction helps the body and the muscles surrounding it kind of calm down so he's not guarding as much. And even just like this little bit in the beginning, like that first week, it helps a lot.
That feels good just to bend my knee.
Yeah, I know. So this is the active assisted in terms of the PT world, active assisted range of motion. So he's using another piece of material or like his body to actually move the object instead of him actively having to use those muscles that are around the scar incision to get the range. Does that feel better? And work your hamstring a little bit too. The good thing with Phil though too is that he knows his body and he's so knowledgeable with strength training that this is gonna just be a step for him as a coach, where he's gonna know an athlete when he gets him next in, like what it takes, what it feels like from start to finish. You know, getting back in the ring or getting back under the bar. So it's gonna be a really good thing for him as a coach. It's a blessing in disguise, right?
See what I do for y'all? Shit, we went extra 2 hours on in the operating room just to show you guys the entire thing. So hopefully you appreciate it.
So here we're doing ankle PREs. So this is another great stretch, especially if someone's having trouble post-op ACL to get that extension. Even meniscal surgery, a prone hang, which is laying on your belly and letting the leg actually hang off the table. Sometimes people will apply a weight on top, but he has really good extension right now, so I'm not worried about that. And some percussion work. And when you're talking about lymph drainage, you always want to go and clear, when you're talking about the lower body or the distal extremities. So let's say he's got swelling in his hand or his foot, you always want to clear the joints above it. So you want to go clear the hip first, then clear the knee, then the ankle, then the toes. Because if you were to clear the ankle and toes beforehand, that lymph is not going to be able to go back up into the circulatory system. So now here I'm pushing the pelvis, stabilizing the pelvis. I'm on top of his knee joint and the incision here, and I'm just gently pulling. I'm tractioning the leg back, right above his incision. Key to keeping extension is that dorsiflexion of the ankle. So a good cue to tell, you know, your patients or athletes, if you're a coach and you're having problems with them being able to maintain that extensor leg, see, and try and get them to control with adding that dorsiflexion of the ankle. Phil had a patellar tendon graft, and we didn't know, but once Doc went in there to operate, he had a meniscal repair as well. The meniscus, the medial meniscus, does attach to the ACL and the MCL. So you'll find that over time, if someone does have an ACL torn, when the doctor goes in, they might find some more damage. But what I like about the patellar tendon graft is that he can work hamstrings much more quick in his recovery than as if he had a hamstring tendon repair. And that's when they take the inner hamstring leg right here, right? The semitendinosus, and they'll take a piece of that and then they'll replace that in. But you can't work hamstrings early on in the recovery phase.
All in all, throughout the process, try to keep a mind of like understanding what's going on and making sure that you're using it as a form of progression. Being as positive as possible throughout the process. It is frustrating at times, but I take it as a learning experience and I take it to understand it, that I can take it with me to my coaching, give you guys more information, and it just increases the value. So make sure you subscribe and hit the notification.
All right, guys, so that's a wrap. For me, day 3, you day 1, and first day with Miss Dr. Christiana Marron. I don't want to say that because she's a doctor. Go ahead, spell your name.
No, we're not doing it again. No. I've made that mistake multiple times. I've learned.
Well, give me your Instagram at least.
It's Dr. Christiana Marron. It's very simple.
We'll put the link down, don't worry, you'll be good to go. All right, if you have any questions, you know what to do. Hit the comments down below. Make sure you subscribe, hit the notification. I'll see you again next time. Peace.